Good morning, everybody. It's Dr. Galvin with another, boy, it's nice to take that mask off, with another sort of post-ER night shift update, second night in a row. You know, the ER gods were good to me last night. I told you it was pretty mellow. I paid the price tonight, boy. Incredibly busy. I think right now we're boarding 30 patients now. Because there's no place to send them. The majority of them are COVID. Probably half of what I've seen the last 2 days has been COVID patients. Lots and lots of sick people. I put multiple central lines in, intubated a number of people last night. People coming in really sick. Probably now we're hitting that wave of people from Christmas and the Christmas holidays that got exposed. I asked a lot of people, had they been around anybody, and many of them said that people that they had met, family members that they'd been with at Christmas time had tested positive, and now they were positive as well. So just incredibly busy. It's just insane. I've never seen anything like we're seeing. And not only in our hospital, but all the other doctors I talk to everywhere in our region in North Carolina. My colleagues in other states are relaying the same thing. Pretty much everywhere is just getting hammered by COVID cases, and we're sort of seeing that wave of cases that began with Christmas that we were anticipating. I think the next couple of weeks are going to be just horrible. For those of you new, my name is Jeffrey Galvin. I'm a board-certified emergency medicine doctor. I work in an emergency department outside of Charlotte, North Carolina. I also run a functional medicine clinic in Charlotte where we do precision medicine and work at optimizing people. We actually are now taking care of more and more people who are dealing with post-COVID long-term sort of problems. We have some pretty good protocols that seem to help that. I've been doing updates since the virus started. And I tend to do these updates, especially after I work night shifts. I only work generally nights, and I usually do it in the morning. We talked yesterday about conspiracy theories. If you've got questions about the vaccine and weird stories you've heard, I did a whole video yesterday about kind of debunking a lot of those things. I got a lot of interesting feedback, a lot of very kind feedback. Thank you very much. I was a little cranky yesterday, I admit, because it just drives me crazy that as I come into this place and I see all these sick people and see my staff completely overwhelmed, seeing patients hurting in hallways, in chairs, no place to transfer them. We actually had COVID patients in the hallway last night. In the hallway. That's not a good place to have an infectious patient. But we had somebody that sat out there for almost an hour because there was no room to put them. And so when I hear conspiracy theories and things like that, it gets me a little mad, and I was a little punchy yesterday. Sorry. My apologies. Today, I do want to talk about numbers. 273,000 new cases yesterday. We had over 3,700 deaths yesterday. Total number of deaths so far, 372,000. I'm going to start talking about vaccination numbers. Worldwide, 25 million doses of the vaccination given. Here in the U.S., we're up to 8 million. The numbers of cases are really accelerating. It took us 90 days to reach 2 million cases in 2020. We reached 2.2 million cases in the first 10 days of 2021. So you can see how those numbers are going up. I had someone on YouTube, and I'm sorry, my brain doesn't always work so well after the long night shift. Someone had a couple interesting questions. And one of those questions was, why are we reading that healthcare workers don't want to get the vaccine? And I think that's a very legitimate question. And I don't know if I have an answer. I can tell you what my perception is, because I know a lot. I have lots of healthcare friends, and I know who's getting the virus and who's not, because they kind of talk to me because I do these videos. In some places up to 40% of people are saying they're not going to get it. Well, generally those are like nursing homes. And you've got to understand that, while there are lots of healthcare providers, the degree of education is different. And what I've found is that the folks who are tending not to want to get the vaccine tend to be folks who are kind of lower in terms of training, maybe a year or two of schooling, a CNA or, a tech or something like that. Those folks that have more training, typically nurses, doctors, respiratory therapists, things like that, tend to be much more interested in getting the vaccine. I think that's going to change as more and more people get it and people see that it's not a big deal. Nursing homes tend to be staffed with relatively low trained people, and I think that's part of the issue. And I think it's just a function of education and understanding. We need to do better with educating. I'll give you an example. My neighbor at my office is an orthodontist, and dentists are kind of in our state are first line people because they're right in people's faces all the time. So he was able to get his staff immunized in the first wave, and only 2 of, I think, 10 or 12 staff did it. And he's asked me to actually go over and kind of talk to them because they're believing a lot of the conspiracy things that we talked about yesterday. A lot of those conspiracies, there's some concerns that, there's some rumors out there that it's going to affect fertility, and there's certainly no evidence that the vaccines are going to have any effect on fertility. There's some people that are upset because the virus, the vaccines came so quickly. It typically takes 10 years and $1 billion to build a vaccine. Here we've done it in a year. Well, realize we put tons of money into it, and when you combine a pressing need with very, very smart people and a lot of money, things tend to get done quickly. And I think that, and I was skeptical at the very beginning, but I got the Moderna vaccine. I'm anxious to get my second one. I think it's very safe. I think they've done an incredible job. Operation Warp Speed really was a lifesaver here. People are worried about allergic reactions. I think I've mentioned before, allergic reactions to me are not that big a deal. Even anaphylactic reactions which are rare, are easily treated. We treat in the emergency department allergic reactions all the time, and I've only seen a tiny handful of deaths from allergic reactions in my 20 plus years as being an emergency physician. So allergic reactions are going to happen, but they don't really worry me. Someone asked me about the potential death. There was a doctor in Florida that died a couple weeks after getting the vaccine. We don't know if it's related. He had thrombocytopenia, which is very, very low platelets. It might not show up. You could have that without realizing it. It caused me to have a stroke. When we have 8 million doses of something, a lot of people are going to have car accidents. They're going to break their legs, within a couple days. There's just so many people. Lots of things can happen. So sometimes, a death may be coincidence. The CDC is investigating it. There are other agencies investigating. We don't know if this death was related to the vaccine or not. And there was another one somebody sent me that overseas. So question of 2 people that may have died from the vaccine. Well, 2 out of 25 million. So that's 1 chance in 12.5 million, if those both were caused by the virus or the vaccine, keep mixing terms here, that you might die. So let's, I was thinking what are those odds seem pretty big to me. So I did a little bit of research. And so this is what I found. So and again, this is a big if, we don't know, if there really have been 2 deaths related to COVID vaccines, so that's 1 death per 1 chance out of 12.5 million to die of getting a COVID vaccination. It turns out that your risk of getting struck by lightning is 1 out of 700,000. In your lifetime, it's 1 out of 3,000. Your risk of getting struck twice by lightning is 1 out of 9 million. So that's lower than that 1 out of 12.5 million. Your risk of getting attacked by a shark is 1 in 3.5 million. Your risk of getting hit by an asteroid is 1 in 1.6 million. Getting killed by a falling coconut is 1 in 250 million. So there is lower risk of getting killed by a falling coconut. But there's a 1 in 2.3 million chance of getting killed by a falling ladder. So, we take risks every day. We take a risk getting into our car. The risks of the vaccinations, so far are extremely, extremely low. And I think I mentioned it yesterday that any real severe side effect from any of these things have typically shown up within a couple months. And we've been giving vaccines, at least on a trial basis, for now 6 months. And honestly, the vast majority of people watching this are probably not involved in healthcare. And so, you're probably not going to getting the vaccine until maybe 150 million people worldwide have already gotten it. So we'll have a lot of safety data. I would not hesitate getting the vaccine for a second. We talk about COVID deaths all the time. There was a very interesting article I read that about COVID deaths in young people, and there have been about in the first half of the year about 12,000 excess deaths in people between the ages of 25 and 44 than compared to prior years, and a lot of that is felt to be related to COVID. So, while you're much higher risk the older you are, I've taken care of a bunch of people who are young, and I have had one or two young folks that I've seen die, but I've seen quite a few younger folks with pretty severe symptoms. And remember, if you get COVID, your chance of having some long-term symptoms from it, be it brain fog, be it weird heart problems, lung problems, is about 30%. So, you really don't want to get it if you can avoid it. And so, again, that's why we always talk about, the masks and washing your hands. People argue with me about the masks all the time. And I go, let's throw the science out the window for a second. Let me just give you a personal example. I have personally been exposed to COVID hundreds of times in the emergency department since March. My staff here has been exposed many, many, many times. At the very beginning, we had one staff member we think caught COVID from the hospital. But since then, we haven't had any. We've had staff members get it, but almost all of them have felt it happened outside the hospital. What are we doing in the hospital that has resulted in essentially no transmission to any staff? Hand washing and masks. And we're not even distancing from our patients because we have to be close to them to examine them. So really, hand washing and masks have protected me from getting COVID. And I had my vaccination on Christmas Eve, but I was curious. And so I actually had an antibody test done the Monday before because I thought to myself, I've been exposed so many times, maybe I got it and I had I was asymptomatic, and my antibody test was negative. So I can tell you definitively, I never got it from March until, December 21st or so, despite being exposed many times. Now, granted, we're using N95 masks, but, my staff has gotten a little bit lax, and a lot of times I'm seeing them go into rooms with just cloth masks, and we have not had problems. So the masking, who cares about the politics? They work. I haven't gotten it. If you don't want to get it, I'd suggest wearing a mask. If you want to get it, don't wear a mask. How's that? Anyway, I'm tired. I'm going to call it a night. I will be back. I have another shift tonight. I'm dreading the one tonight because of such bad. It was so bad tonight, and it's only going to get worse. I don't have any preconceived notions it's going to be a good night tonight. Anyway, everybody stay safe, wear your mask, wash your hands, look out for yourselves, look out for your families, and look around, be a good citizen, look out for those around you. We'll get through this together. Everybody stay safe. I'll see you tomorrow.